Advanced Clinical Procedures Periodontal Assessment Project by Christy Showalter. Good afternoon. The patient I'm going to tell you about today, his name is Michael Fox. He is a 55-year-old male, Caucasian. He suffers from arthritis and Parkinson's disease. He's lived a fairly healthy lifestyle since being diagnosed 10 years ago, married with 2 kids, and is a previous smoker. Medications Michael is currently taking are Sinemet, which is for Parkinson's, one 100 milligram tablet by mouth 3 times a day. Special considerations when taking this medication: patients with cardiac and respiratory disease should use this with caution and do not use with MAOIs. Oral effects: your saliva can turn a dark color and experience xerostomia. He also takes ibuprofen for arthritis, 800 milligrams 3 to 4 times a day, with the risk of stomach ulcers and bleeding, higher risk for kidney and cardiovascular damage. Contraindications of this medication: patients with kidney disease and uncontrolled hypertension. Oral effects: mouth irritation and xerostomia, although these are rare. Michael's periodontal assessment shows generalized bleeding upon probing. In the upper right quadrant, he has signs of recession, 4 to 6 millimeter pockets, as well as tooth mobility on number 4. In the upper left quadrant, Michael has pocketing ranging from 4 to 6 millimeters, signs of recession, as well as a grade 1 furcation on number 14 and mobility on number 14 as well. In the lower left quadrant, Michael has signs of recession, furcation on number 18, mobility on 18 and 19, and pocketing ranging from 4 to 7 millimeters. In the lower right quadrant, Michael has pocketing ranging from 4 to 7 millimeters, signs of recession, grade 2 furcation on number 30, as well as tooth mobility on numbers 29 and 30. Michael's AAP periodontal classification. Patient presents plaque-induced gingivitis due to inadequate biofilm removal because of physical disabilities, as well as chronic generalized moderate periodontitis with localized advanced periodontitis in the lower right and lower left posterior. Patient presents generalized gingivitis with bleeding upon probing. Generalized ADA Class 3 periodontitis throughout dentition with probing depths 5 to 6 millimeters, visible furcations on teeth 14, 18, and 30, and horizontal bone loss. Patient also presents localized ADA Class 4 periodontitis in the lower right and lower left quadrants with visible furcations, alveolar bone loss 5 millimeters below CEJ, and 5+ clinical attachment levels. Radiograph findings support crown to root ratio 2 to 1, bone loss, and furcations. Gingiva color has generalized severe blanching from the free gingiva to papilla. His gingival contour has generalized severe, rounded, and receding margins from the free to papilla, and localized festoon margins with generalized cratered papilla. Gingival consistency presents severe, generalized, soft, and swollen from the free and attached gingiva, and gingiva appears generalized, severe, shiny, and loss of stippling from free gingiva to papilla. ADA case type 3 generalized and ADA case type 4 localized. The AAP classification: Michael presents plaque-induced gingivitis due to inadequate biofilm removal because of physical disabilities, as well as chronic generalized moderate periodontitis with localized advanced periodontitis in the lower right and lower left posterior quadrants. ADA case type: patient presents generalized gingivitis with bleeding upon probing, generalized ADA class 3, moderate periodontitis throughout dentition with probing depths 5 to 6 millimeters, visible furcations on teeth 14, 18, and 30, and horizontal bone loss. Patient also presents localized ADA class 4 periodontitis in lower right and lower left quadrants with visible furcations, alveolar bone loss 5 millimeters below the CEJ, and 5+ clinical attachment level. Radiographic findings support crown to root ratio of 2:1, bone loss, and furcations. Gingival description. The gingival color has generalized severe blanching from free gingiva to papilla. Gingival contour has generalized severe rounded and receding margins from free gingiva to papilla and localized festoon margins with generalized cratered papilla. His gingival consistency presents severe generalized soft and swollen from free to attached gingiva, and gingiva appears generalized severe shiny and loss of stippling from free gingiva to papilla. In this image of the radiograph, you'll notice 16 to 30% radiograph bone loss throughout dentition, horizontal bone loss, a 2:1 ratio, visible furcations, and alveolar bone 5 to 6 millimeters below the CEJ. In the first gingival image, you'll notice swollen, shiny, and blanched attached and free gingiva, generalized cratered papilla, moderate calculus, and signs of recession. Gingival image number 2, you'll notice bleeding upon probing, blanched gingiva, loss of stippling, signs of recession, and 7 millimeter pocket depths. We also have another look of the gingiva with cratered papilla, soft and spongy gingiva, generalized recession, tooth mobility, as well as a grade 2 furcation. Here in the upper anteriors, we notice festoon papilla, signs of recession, soft and shiny gingiva and papilla, and as well as cratered papilla. Patient prognosis is fair. Due to the patient's extreme challenges with dexterity because of his disease and chronic periodontitis, the outcome, we want to reverse the severe inflammation and control current disease with periodic maintenance and help of caregiver. Short-term therapeutic goals, we want to arrest the active infection, reduce heavy inflammation, remove all calculus, and use metronidazole for 7 days in conjunction with SRP. Long-term therapeutic goals, have caregiver help with brushing, continue using electric toothbrush for ease of brushing for patient, keep patient on a 3-month recall, and control perio disease. Modifiable risk factors, home care instructions with patient and caregiver to help with adequate brushing and interdental care is very important. Improve xerostomia with recommended products. Non-modifiable risk factors, lack of dexterity due to Parkinson's and arthritis. Treatment planning for Michael will consist of a comprehensive initial evaluation and limited oral exam, problem-focused. Also, preliminary debridement, SRP on all 4 quadrants, gingival irrigation per quadrant after SRP, keep him on a 3-month periodontal maintenance recall, topical fluoride every 3 months, and oral hygiene instruction to both patient and caregiver. Treatment plan will go as follows. First appointment, problem-focused exam with a preliminary debridement and oral hygiene instructions with patient and caregiver. Appointment 2 will consist of a comprehensive exam, SRP on the upper right quadrant, gingival irrigation, as well as a prescription for metronidazole in conjunction with the SRP. Appointment 3 will consist of SRP on the upper left and gingival irrigation. Appointment 4, SRP lower left with gingival irrigation, and appointment 5, SRP on the lower right with gingival irrigation, polishing, and fluoride. Michael will continue to come back every 3 months for perio maintenance and keep reiterating oral hygiene instructions to patient and caregiver. Instruments that I will use will consist of Gracie's, standard after 5, mini 5, and Anna Pattinson, standard and rigid, to help remove light to moderate calculus, fine scale, and a finishing stroke. Scalers, anterior and posterior sickle scalers with standard rigidity to help remove moderate calculus. I will also use ultrasonic inserts, Slimline 100 and Slimline 1000 for initial debridement SRPs and perio maintenance. Home care recommendations consist of Clinpro 5000 toothpaste, metronidazole, 250 milligrams 3 times a day for 7 days in conjunction with SRP, dental aids such as power toothbrush, water pick, and Biotine to help with xerostomia, toothbrushing, the modified BASS, use of a power toothbrush. If dexterity is an issue, have caregiver help with brushing. Toothpaste, Clinpro 5000, use once a day in place of conventional toothpaste and brush for 2 minutes. I recommend Superfloss and a floss holder for patient, and if patient cannot perform flossing on his own, to have the caregiver help him. Interdental aids include a water pick. Because of lack of dexterity, a water pick handle might be easier to use, and use it once a day. Mouth rinses, Listerine, anti-cavity in conjunction with Biotine. He can use Biotine up to 3 times a day for dry mouth. Fluoride, I recommend the Clinpro fluoridated toothpaste and topical every 3 months during perio maintenance. Also, the patient needs to avoid sharp objects such as trying to use floss picks due to the tremors and lack of dexterity. Parkinson's patients typically experience low blood pressure due to the medications as well as constipation. I've recommended to increase fluid and fiber intake to help with the constipation, and this would include things such as fruits, vegetables, legumes, whole grain breads, and cereals. Foods with antioxidants is also another great thing to add into the diet of a Parkinson's patient, or anybody in general. This would include things such as bell peppers, artichoke, kale, apples, grains, nuts, and dark chocolate. I've also encouraged him to spice his foods with turmeric. Turmeric is a natural anti-inflammatory spice that will help with the stiffness and inflammation in his joints due to arthritis. It's also recommended to limit caffeine and alcohol, as these can lower blood pressure, which is a common problem for a patient with Parkinson's. Supplements I've recommended would be fiber to help with the constipation, and to help with arthritis, supplements such as turmeric, fish oil, and gingers can help with inflammation.